What is diabetes? What is diabetes? A lot of people ask that question and fall into the assumption that diabetes is about the sugar that you put in your food. So most people would say, I don't eat sugar anymore, so I don't have diabetes. Well, not eating sugar can help to prevent diabetes, maybe a tiny aspect to that. But really, we need to go back to the basics and understand what diabetes really is. It's actually a long-term disease that affects how the body breaks down the food that we eat and converts it into glucose, which is a form of sugar. So going back to the question, people say diabetes is about sugar. Yes, it is about how the body responds to sugar. When you eat food and that food is broken down and converted to glucose, it's sent into the bloodstream. That signals the pancreas to produce insulin, and insulin then takes that glucose to the cells, and that require the glucose for it to function. That is the simplicity of diabetes. But diabetes is not just looking at your sugar content. It can affect major organs like your heart, your kidneys, your eyes. It can affect minor organs. So it can affect nerve endings, it can affect your toes, it can affect the feelings that you have in your feet, it can affect the organs for man. And therefore, it can cause erectile dysfunction, and that can cause a problem in marriages. Diabetes has a vast majority of complications. It can affect mental health, dealing with the understanding and dealing with how the diagnosis of diabetes and the stigma. But should there really be a stigma to diabetes? It's like any other disease. But yes, it can be caused by what we put in our mouth and our lifestyle. But there is also the genetic aspect to it, depending on the type of diabetes that you have. Some can be reversed and some cannot be reversed. But how do we deal with it? When you come into a clinic of a diabetes specialist, we don't just look at your sugar levels. We look at everything. We look at how are your eyes performing? What is your target level? How are your feet? What's happening to your feet? Do you have healthy feet? Can you feel things? We give you advice. What's your heart doing? How is your blood pressure? How is that in response to things? What is your cholesterol level? You may ask why. The answer to this is, without looking at the full picture, it's a little bit like setting off 3 bombs in a house and then detonating 2 bombs or 1 bomb and expecting everybody within the house to live. The other bomb is going to go off and there will still be some form of death. So what we do is, without the stigma, without everything, we throw away every stigma and we look at the whole picture. We look at how do we prevent all of these complications from happening or causing really, really bad effects for you. So we send in the specialist and we look at all the different levels and we try to detonate the 3 bombs, not the 1, not the 2. Diabetes requires a whole lot of skill. It requires a whole lot of knowledge. It is not just about sugar. It is about so many other things. So please, when you're dealing with other people, we have to look at your diet. We have the dietitians, the nutritionists, the ophthalmologists, the different specialties that connect to one